So with gum disease, one of the things that I tell my patients is that, the soft sticky stuff you get on your teeth is plaque. My mom used to say it was the sweaters on your teeth when you'd wake up in the morning, but that's bacteria that's actually growing. We all have it. We can't get rid of it. You can brush and floss, but you can't get that bacteria. It's normal flora. It's the fancy way of saying it, but we all have this bacteria that's in our mouth. But when that stuff sits on your teeth for a while, the calcium that's in our saliva, that comes from the milk and the cheese and the calcium that we get and we eat, but it comes back out in your saliva. When the calcium that's in your saliva hits that plaque and the plaque sits there for a while, it becomes calcified. And once plaque, which is the soft sticky stuff, becomes calcified, it becomes what we call calculus or tartar. And calculus or tartar is what I jokingly call, and you can see it on an x-ray, it looks like a spike sticking off the tooth. I'll tell a patient you got barnacles on your teeth because it's like barnacles. But when it sits there for a while, the first thing the body's going to do to protect itself is it bleeds on it. And that's why our gums bleed, is because the body's actually trying to get all the good stuff that's in our blood that fights this infection, and so it starts bleeding on it. And but the mouth, unlike the rest of our bodies where it can circulate around and do its job, it bleeds out into the mouth and we either swallow it or spit it out. That's why you see the pink in the sink. So that's the first thing that'll happen. That's gingivitis. That's the first stage of gum disease. And then what'll happen is the body realizes in periodontal disease, it'll say, hey, we're not beating this thing by bleeding on it. So we're going to take it a step further. And then what happens is the body releases chemicals that tells the tissues around the teeth, which will be the bone and the soft tissue that's holding on to the teeth, to just go away. Because back in caveman times, I guess the way God made us was that, if we can't get rid of the infection by bleeding on it, then we're just going to get rid of the whole tooth. And so the body's just trying to get rid of the tooth. And I guess that was fine way back when we didn't know anything about it. But now we know what causes it, and all we have to do is knock the barnacles off the teeth, and as much as possible bring things back into a normal balance. Like I said, you can't get rid of the bacteria that's there, but you can bring things back into balance. Same thing in our stomachs. We have to have good bacteria down there, and you want to just have those things back in balance. And periodontal disease is when some of the bad bacteria has gotten a foothold and it's really causing a problem. So once that bone is gone, you can't really get that bone to come back, but you can reverse the inflammatory process and get the gums to quiet down and stop it from getting worse. But the other thing people, and I have to stress this too, it's when you've got periodontal disease, it's a lot like high blood pressure. I use that analogy a lot. You can get your blood pressure under control, but you're always going to have a tendency to get the high blood pressure again. So unless you're exercising and eating right, you're going to have a tendency to get the high blood pressure. So once we get people under control, whether that's with gum therapy, where we do maybe scrape the teeth, or scaling and root planing is the fancy word for it, or use a laser on it, or we use local antibiotics, where we actually put antibiotics in these pockets around the teeth, we can get all that under control, and they come in 2 months later and woohoo, everybody's happy. I'm super happy, especially when everything clears up and becomes manageable by the patient and us, because we have to work together. But the one thing that I see that ruins this is sometimes people kind of fall off the bandwagon, so to speak, and they don't keep their prescribed appointments. And when a person has had periodontal disease, you can no longer be the 6-month person that you used to be. If you used to go every 6 months, just because your insurance only pays for 2 cleanings a year doesn't mean you don't need it. The insurance company doesn't. They're not your doctor. They're there to help you pay for that. But so I stress to people, most of them that have had it for a maintenance program, they need to be there every 30 or every 3 months. So it's every 90 days. And there's some science behind that. And the science behind that is that for people who are predisposed to get gum disease, the bacteria that are causing a problem, if we go down in there and we break up the colonies and we disrupt it and allow the normal balance to come back, it takes about 90 days for these bad bacteria to get a foothold and start causing a problem again. So if the person's doing their brushing and flossing at home and they come in and allow us to keep disrupting the bad bacteria from kind of getting a foothold again, it allows us to keep this under control. But like I was saying, the one thing that I've seen that ruins this is people they don't keep coming in, and they'll go a year or two and they come back and we have to redo the gum therapy, which is expensive, it's painful, everybody's grumpy about it, but they could have prevented it if they'd have just continued to come. And it's just the way it is, you know. I mean, once you've got it and you get it under control, you just have to make the commitment. And a lot of times I'll tell somebody when I'm sitting there talking to them about getting it under control, look, are you gonna, you know, you're gonna follow through with this? Because I want you to kind of think it through. It isn't just, you know, we got it under control, it's fixed. Because it's an ongoing process to manage it. So you have to manage periodontal disease.